Hello everyone, welcome to another episode of TooHealthTalk, a show where we get to share real challenges and get to break it down in a very honest and simple conversation. On today's episode, we have Dr. Aminu. Dr. Aminu has been with us before, and I'm happy to have you here again, Doctor. Welcome to the show.
Thank you so much. Thank you for having me again. Thank you, viewers. I'm happy to be here as part of public awareness that we do with this gentleman.
Yeah.
Thank you for having me.
You're welcome, Doctor. So, Dr. Aminu is a family medicine physician, and I'm very happy to have him today. And today, we're talking about hypertension, Doctor. So, hypertension gets affect these days, both the young and the old these days. So, I want to break down what hypertension is and why is it called a silent killer.
Thank you very much for this very important question. It is one of the diseases that we have all over the world. Is all known, but as you said, what is hypertension? Hypertension is persistently elevated blood pressure. The pressure in our blood, when the heart is pumping blood, it pumps out, and the pressure that it pumps with, it goes to all the organs. So that's why there is a normal, what they call normal pressure, is between 110 or let me say, if I include the women, is between 100 and 100 and say 10, 110 over 80 to 120 over 80 is usually the normal. But sometimes, it can go beyond that. Even recently, the American International Heart Association has reviewed the normal range of what is the normal hypertension, normal blood pressure. They are also of the opinion that it should stop at 120 over 80. So what if somebody's blood pressure is persistently high to beyond 140 over 90? You can be said this is hypertension. And why they are calling it silent killer, for example, is because hypertension, occurs in the body without you knowing. It happens very slowly, very silently in most people, in majority of people. Only few people have the signs of hypertension or like headache and other things. So they call it silent killer because, of course, it can cause so many things in the body. It can cause stroke, bleeding in the brain is stroke. It can cause kidney problem. It can cause so many organ problems. It can have a problem. You can have problem with the eye, So they call it silent killer. You could have heart attack, myocardial infarction, sudden heart attack, which is very common these days. You see a lot of young men and women are having sudden, heart attack, especially in the morning. You just hear somebody went to bed and then wake up in the morning, they found him dead. And what all they will find is his heart has sparked up, so-called heart attack because of hypertension.
So, Doctor, hypertension is a very, very, very common in Africa and mostly in Nigeria. And now these days, hypertension gets to affect both young and old.
Sure.
So, can you give us a brief explanation of what's hypertension?
Well, hypertension is persistently elevated blood pressure above normal levels. The goal level is above or equal to 140 over 90 millimeter of mercury. It's called a silent killer because it often shows no symptoms until it causes serious complications like stroke, heart attack, myocardial infarction, kidney failure, or even death. So that's why they call it a silent killer.
How does hypertension affect the heart in general, and gets affected? I heard also that hypertension gets affect the brain also.
Yeah, blood flow to the brain and blood flow to the heart is the same thing. Well, for the heart, it has only two narrow, blood vessels, two blood vessels that goes to the artery and veins, and they are narrow. It also supplies the heart. If there is anything that will reduce the amount of blood to the heart, of course, it can cause problem for the heart. Or if it blocks the supply of the heart, that's why they call it heart attack. Same thing in the brain. If there is no much supply, you could have brain ischemia. You can have stroke. The stroke can be due to ischemia. Stroke can be due to bleeding into the brain cells.
So now, what is this common lifestyle factors that get to cause hypertension?
Well, the lifestyle, most people don't know that they are hypertensive because of their lifestyle, as you said, because of what they eat, and because they don't check their body. One of the lifestyle is sedentary lifestyle. If you don't exercise, you are not doing exercise here and there, then you gain a lot of weight, and the heart will have a lot of weight to pump blood uh, to all the vital organs. Food that we take that contains too much of salt, too much of fat, too much of high carbohydrates can also contribute to you developing high blood pressure.
So how much salt intake can influence high blood pressure?
Well, if you take more than 5 grams per day of salt, you are taking too much of salt. So uh, it is important that you don't take too much of salt. Uh, 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 Excess salt intake can obesity, physical inactivity, smoking, alcohol use, stress, and unusual unhealthy diets rich in processed foods that we are taking these days is one of the things that is causing uh, uh, high blood pressure, uh, and it affects people who don't have a good lifestyle. That's why some of the advice is lifestyle changes.
So now, how can young people get hypertension?
Of course, why not?
Why?
They can get hypertension because they are even the most vulnerable these days because they are under stress. They are hustling. They go about doing, looking for what to eat. They are the most stressed, and they are the ones that also indulge in eating a lot of processed food, unhealthy food, the salty, the fatty, junk meals, and what have you. So they are stressed, and stress can cause temporary spikes, but chronic hypertension usually develops when stress is combined with poor diet, inactivity, as I said, obesity, and maybe inheritance, genetic predisposition.
When you talk about genetic predisposition, like how does that work? Is it that, oh, if your parents have, if your father has hypertension, like there's likely tendency of you having hypertension?
Sure.
Now, how can someone prevent that?
You can prevent it by if you know that your parents have hypertension, and you should try and get aware of what is the cause of hypertension. How do you prevent it? By actually listening to health awareness like this, and then you be careful about what you eat. You be careful about your exercise, and you should also go to the hospital for checkup. It's very important. You cannot emphasize the importance of checking your blood pressure because you want to prevent, getting hypertensive just like your parents have, because definitely you have a tendency to have it as well.
Now, when you talk about lifestyle changes, what if someone gets to have this hypertension for like after like maybe 5 years and person get change, but it's like the person gets to change he or her lifestyle? Does the hypertension get to reverse? Like, can someone like be fully healed from hypertension?
Well, I can say yes or no. Hypertension is a chronic disease that once you have it, you will have it for life. You can only manage it. But if you can uh, check yourself, and for example, if you know your parents have it and you are checking yourself, trying to prevent it, from having it, and you actually cut down on especially salt and junk food, fatty meals, high carbohydrates, and then you also indulge in exercise, you may be lucky you will not have it. or you may be lucky if it's coming up, you may actually prevent it from coming up. But it's really difficult, for you, because as a human being, you could be able to cut down your salt intake and do exercise, but sometimes you may have some stress as well. So stress can be one of those that is very difficult for you to prevent. So the thing is, if your family have it, you have a tendency to have it. And all you do is you should be very, very aware. They call it surveillance. Be checking yourself and make sure you are not getting there. If you are getting there, you do so many things to prevent you from getting there. If you get there, then you now also be taking medications, and then following the advice from your doctor.
Okay, so what are the common risks of hypertension in general? Like, how can hypertension for pregnant women, can hypertension affect them to give birth? For men, can hypertension affect them like to do their like normal performance as a man and stuff like that?
In women, of course, hypertension affects them. It affects their body just normally the way it affects men. But if they get pregnant, for example, they are prone to have what they call preeclampsia or eclampsia, as the case may be. They could fit when the blood pressure is higher than normal. So of course they stand a risk of having stroke, during pregnancy or during childbirth. So it is important that they are also at risk.
So for men and women now, who is more likely to have hypertension between a man and a woman?
Wow.
Because for man now, for me personally, I would say, oh, a man who, based on my little knowledge,
Yes.
men get to have more. You get to see more of men coming
Yes.
out with hypertension
Yes.
than women. But when you get to look at the so when you, for me personally, my own observation is that men gets to like have come out with um, hypertension more than women
Mm.
for me.
Mm.
But looking at it in the other way, that women when they get pregnant, like they get to have this same issue of like having high blood pressure and the rest. So I can't really put it that oh, men gets to like come out with hypertension like more than women. So for you now, if I'm going to ask you now, who comes out with between men and women, who has more like who is prone to be like more hypertensive?
Men are more prone to be very candid because they are the one that is vested with most of the challenges of life. They are the ones who take care of the home, provide food, provide all the needs of the family. Even before he gets family, there are his siblings and there are other things. There are hustles. He has to be hustling to get job. So, and he eats all manner of things. He's not careful. He's not taking healthy food. So he's more prone to get hypertension. But not to say that women don't will not get it too. If some women are also under the same kind of challenges like the men, these days women are also going up and down looking for what to eat, how to get job, and the rest. So they are also prone to the same, hypertension.
Now, can you, before we go now, can you give us like a general overview and like advice to those living with hypertension and those that are trying to prevent like having hypertension, like a general advice for everyone?
Well, generally, of course, the advice is one, you have to uh, be aware that hypertension is a common thing, especially in blacks. And if your family have the history of hypertension, so it is for you to also, check yourself, checking yourself in the hospital. First of all, you have to avoid certain food, salt, avoid salt, avoid fatty meals, avoid sedentary life. You have to be very up and doing exercise, especially walking exercise. Avoid tobacco, no smoking, no alcohol, because those things can, because some people will say less this, less that. But personally, I say no to smoking, no to alcohol, okay? And then no to taking energy drinks, caffeine, or stimulant. All these things can predispose you to having hypertension. And of course, checking yourself regularly in the hospital. Go for comprehensive medical checkup, and then that will guide you to be able to actually take care of yourself.
Okay, thank you very much, Doctor, for this insightful conversation. And at this point, we've come to an end there. We've come to the end of the episode today. And if you want to see more of our doctors come on board to talk about trending health topics, please like, share, and subscribe. See you in the next episode. Bye for now.
Thank you so much for having me.